November is Lung Cancer Awareness Month, and we're learning more with Monica McDonald, who joins us now. She's a nurse practitioner at CHI Health Francis, and you guys are working to increase the awareness of lung cancer, the importance of getting screened. So, first of all, tell us a little bit more about Nebraska's record with lung cancer, if you will.
Right. Nebraska's record's not really that great. It's lung cancer is actually the leading cause of cancer killer in Nebraska, and our state currently is only ranking 27th in screening rates right now. So that's really unfortunate because the American Cancer Society actually estimates about 1,340 new cases and 630 deaths in Nebraska due to lung cancer. Last year in 2022, unfortunately, only 6% of Nebraskans that were at high risk for lung cancer were actually screened.
Okay, let's dive into those not so great numbers. What does lung cancer screening look like, I guess? What is that process?
Right. So the process of doing lung cancer screening would be to talk to your primary care provider. You start with them, or let's say you see a specialist for lung cancer. You can start with that doctor. You see a heart doctor for cardiology. Any physician, any advanced practice provider is able to order a low dose screening CT, which is the only recommended screening test for lung cancer right now. And it's considered low dose computed tomography, also known to us as low dose CT scanning. Once you meet with your physician or advanced practice provider, there's actually certain eligibility criteria that you need to meet, just like if you were having a mammogram or prostate cancer screening or cervical cancer screening. There are certain guidelines that you'll talk to your healthcare provider about to see if you meet those guidelines and then proceed with the actual CT scan itself. Lung cancer screening eligibility includes people ages 50 to 80 years of age, usually with a 20 plus pack year smoking history, and who currently smoke or they have quit within the last 15 years. I think usually the most confusing part about that is the pack year. And so to kind of explain that in a little bit more, a pack year smoking an average of 1 pack of cigarettes per day per year. So like a quick example of what that would be, if you were someone that smoked 1 pack of cigarettes a day for 20 years, you'd hit that 20 pack year. Or if you were someone who smoked 2 packs of cigarettes for 10 years, you'd meet that 20 pack year requirement or eligibility requirement for meeting lung cancer screening. The other thing too, once you meet with your provider, they send an order over to your local hospital that is able to do CT scanning. All of the CHI facilities within our network are able to provide low dose screenings. Right here at St. Francis and CHI, we're able to do those here. Once those results are looked at by a radiologist, the person who ordered that test, the physician, the APP, they'll actually be responsible for reviewing the results of that test. And hopefully, or depending upon what the results are, you'll move from there. If there isn't anything that's seen that's abnormal on that screening test, you'll continue to have that done. It's a yearly exam that they recommend doing. If there are abnormalities, then you'll continue to follow with your primary care provider or whoever you follow with, and just kind of keep a close eye on that. And if there's any other abnormalities moving forward, then you're looking at, further workup, further testing and things like that. So does that make sense?
Yeah. Curious on your thoughts. I mean, a lot of Nebraskans are just really stubborn people. Why are these screening rates so low, I guess is what I'm getting at.
I think part of it is not really knowing that it exists and it's out there. A lot of us, we go see a primary provider for general healthcare maintenance all the time, right? And when you go, it's mammogram, it's colonoscopy, it's vaccinations, it's all of these things that we've gotten used to. And so this is kind of an added layer. We didn't have lung cancer screening for the longest time. So now they're trying to push that and kind of that it's available. It just people don't know that it's there. And I think that's the biggest thing. So that's kind of the push now, and talking with you is letting people know that, hey, this is a service that's out there. It can be as easy as, getting a mammogram or, cervical cancer screening or a vaccination, that it's available. The other hard part too is, a lot of Medicare and private health insurance plans, they're starting to cover lung cancer screening without any cost sharing. And so, eligibility is going to change based on whatever plan you have, but a lot of them are updating their criteria to now include this to match all these new guidelines now that we actually have this test available.
Absolutely. And like you kind of already alluded to, screening is the key to early detection, which is the key to hopefully surviving it or, finding a good treatment plan, right?
Right. Right. We have a lot of people who are out in the field right now. It's harvest time. So, people are kind of wrapping that up and getting into fall. So now would be a great time to, once you get that work done, to get in and see your primary provider or your specialist and talk to them about those kinds of screening things. I think something too, people, because Nebraska is beautiful and, everything is wide open, I feel like there's a lot more claustrophobia in Nebraska. And so some people also might be scared or worried about, well, a CT scan, that's big and scary. It's actually just a low dose. It's a special kind of x-ray that takes multiple pictures. And really, as a person, you just lie on a table, and this table this table slides you in and out of the machine, and the computer combines these images in a detailed picture of your lungs. So it's usually pretty open. So I know people sometimes are scared of the actual test itself, but it's not invasive. If you've had an x-ray for anything, a broken arm, a broken leg, it's very similar to that same kind of test. So that's good to know too. It's a very simple, easy test to do as well.
Yeah. Yeah. Well, Monica, what else is important to mention that we haven't yet had a chance to touch on when it comes to lung cancer and making sure that people get screened?
In my field of work, I do just really want to emphasize, the earlier we can detect and find and catch cancer, the higher the cure rates are, the better the prognosis is to live longer, to enjoy life, to spend time with your family and friends and working or whatever you enjoy doing. It's much more difficult on our end to treat it when we find it in late stages and late disease. It just makes it still, there are still options, and we still treat people, but it just makes things quite a bit more difficult. So, yep, early detection, like you said, early detection, prevention, that's key. That's key for everything. So, we have this test, it's available. Things are changing, people are adjusting, insurance companies are adjusting. So the piece now is put on the people to get in and get the screening done.
Yeah, a lot of great insight. And again, we've been visiting with nurse practitioner Monica McDonald. Monica, thanks so much.
Yes, thank you very much.